Hello everybody, you are watching the Rainbow and Bloom channel. If you're new to this channel, this is a channel about living and thriving with the autoimmune disease called scleroderma. Scleroderma is an autoimmune condition that causes overproduction of collagen in the body. Most obviously in the skin, it causes thickening of the skin or hardening, which is where the name of the disease comes from. And today I want to talk about a book. Now, when you are diagnosed with scleroderma, I'm sure you're scouring the internet for information, you're asking your doctors questions, and you want answers. You want to know what to expect. You want to know, what you're in for. And so when I was diagnosed, I bought every book I could possibly find. I have to admit, I didn't read them all, but I did a lot of research. And so I wanted to talk to you about this book called The Scleroderma Book. And this book I highly recommend. It's a great resource for patients. It's written by Dr. Maureen Mays. And she is on the board of the Scleroderma Foundation, and she's actually based in the University of Texas, Houston, in the medical school. So she wrote this book to talk specifically to patients. I have to stop looking at myself. To talk specifically to patients about issues surrounding the illness, dealing with doctors, and even goes into testing, the tests, and genetic features of scleroderma, all kinds of topics that you would be interested in. She sees scleroderma patients. Obviously, she's a specialist in this area. So she wrote this book. I have the second edition, and it's called A Guide for Patients and Families. So I wanted to specifically focus on the end of the book, like the last chapter of the book, where she gives tips. And it's tips on managing your doctors. So it's called Test After Test, Doctor After Doctor, which we've all experienced, right? So you go into all these different doctors, and it can be overwhelming, and you want to be able to know that you have a team who's working on your behalf and that they're coordinated. So, the rheumatologist doesn't really know necessarily about pulmonology, and the pulmonologist won't necessarily know about, cardiac issues. And she, in this chapter, she goes into the importance of coordinating because, the medical field these days is very complicated, even though we have a lot of tests that can diagnose illnesses that were not so easy to diagnose before. Now it's, given rise to so many specialties and subspecialties, and it's important to have your team of doctors coordinate together. So among the tips she has, tip number 1, get copies of your own medical records and keep these in a file. That's so important because, sometimes you might need to switch a doctor, and then you have to go through the whole process of explaining what you've been through. But it's a good idea to have your own records, to not have to wait for somebody else to send the records to your new doctor or, another doctor you're working with, so that they can read up on what you've been through beforehand, before they talk to you. And so you can get the most out of your appointments. And the second thing she said is have the nurse put your records in your chart before the doctor sees you. That's really important. Like I said, it goes back to number 1. You first of all want to know what they're reading, even if you don't understand it, what all these levels mean and all that, and how they work together. But you at least want to have, a look and see what's going on. So when they're talking to you, you can kind of have a frame of reference, what they're talking about. And so the reason that you want your nurse to, that's the reason you want your nurse to put the records in your doctor's chart before you get there. She says, I can often finalize my diagnosis and offer a plan of treatment if I see this information available the same day I first see a patient. Because it can be really frustrating when you're talking to a doctor and you're going because you do want some kind of something to take away to help you move forward in planning your life and coordinating with, you know, your disease and everything. When the doctor then has to, after the fact, look at your record and get back to you, it's kind of like a wasted appointment. So it is best to have the doctor able to plan a course of action for you then and there. And so tip number 3 is identify the quarterback. And I completely agree with this. You want one doctor to really be in charge and coordinate with all the other doctors for you. You want one doctor as your contact who can talk to all your other doctors and see what's going on and plan from like your you know, your what do you call it, the cockpit or whatever. You know, like that's the place where the decisions are made with one particular doctor. Usually it's the rheumatologist. For me, it was my rheumatologist. She coordinated with the oncologist, the pulmonologist, the, you know, cardiologist, physical therapist, you know, occupational therapist, and you know, everything in between. You know, she was the one who really handled everything for me and can give good referrals. Hopefully you have a doctor that can give you good referrals too. She says, this is the doctor who is going to coordinate your care. This may be your general practitioner, your general internist, your rheumatologist, or another specialist. For my scleroderma patients who need tests from other specialists and who will likely get treatment based on the results of those tests, I want to be the one calling the shots. So you definitely want your doctor to be like your advocate, you know, that person fighting for you to make sure everything's in order and optimize, you know, all the resources available to you and in your time. And then tip number 4, make sure all your subspecialists have all the other doctors' reports. Definitely. Now with me, all my doctors are in the same system, so I don't really have to be, you know, finding out, making sure one person sees this and that. They can all see everything in the same system. And a lot of these hospitals have like cooperatives where they can log into another hospital system to access your records with your permission. So that's another thing that could make life easier for you. And then tip number 5 is, it is not necessary in most audition. I was an actress. In most situations, to have the specialist call your primary doctor. This kind of communication is usually done by letter, which is dictated on the same day that you are seen. So your primary care doctor may not be as involved as the specialists are in your care, but when you do have to go see your primary doctor, it's important that they know all the stuff that was going on before you came to them. If they're going to prescribe something to you, they need to make sure that there's nothing, you know, that everything will work together. And you know, you may go in with a symptom for something, but your doctor may say, well, you need to see this specialist or that specialist, and let me know what they say. And then the 6th tip is, you, your primary care doctor, and your rheumatologist are going to have a long-term relationship. We know that. Figure out who in the office is the person who handles referrals and is the one who can get the doctor's attention. Definitely, because so many doctors, you know, especially with these rare illnesses, they have a lot of people coming to them with this illness. You don't want to be, you know, put on hold and, you know, days to get back to you. This may be the office manager, the receptionist, or the nurse. Before you run into problems, find out when the best time is to call, when the doctor is likely to call back. Some doctors make return calls at lunch or in the evening. If you are having a problem, call as early in the day as possible so that you can get on the list of people to call back. And then she goes into who to call. She goes into what to do in the emergency room. Yeah, so this book is really, it's a very practical book for, you know, dealing with your illness. You know, and have family members, like if you have somebody in your family who's, I'm sure you do, helping you manage all this stuff, it's good for them to read this too, because, you know, it can help them figure out, you know, navigate all this craziness with you, so you're not by yourself. And You know, you don't have to like explain everything to them and they're wondering why you're doing one thing or another. They need to have the education too, because, you know, like she says, this is a long-term thing. This is a long-term relationship, and with your doctors, but also obviously with your family members who will be helping you. So it's definitely important to have them. I know from my experience, it's important to try to make them aware of what's going on, and, you know, hopefully you have more than one person, and because one person isn't good at everything. Some people are good at listening. Some people are good at administration. Some people are good at, you know, cooking and cleaning. You know, it's good to have a little team at home too to help you, because this there's a time when it gets kind of worse. It gets better. In my case, I'm speaking from my own perspective. There's a time when it gets so much worse. Like I said, I was completely flat on my back for a long time and couldn't do anything for myself. And there's a time that it gets better. So it's really, you know, important to have people working with you who are at least empathetic and have some knowledge of what it takes to manage all of this, so you don't have to deal with overwhelm all the time and miss things like appointments and medications, taking your medications on time, and then other life stuff. Like like I said, this is like having 5 full-time jobs, you know. So you definitely try to have as many people on your team as possible at home, and make sure that you know, have the courage to call the shots in your own health management, because, you know, as caring as some doctors can be, they're not in charge. You're in charge, and you have to always keep that in mind. So that's it. That's one book. I have more I'll talk to you about, and some other stuff, of course. Thank you for watching, and I hope this was helpful. Please let me know in the comments if you've read this book and what other books you have read that have been helpful to you. And if you haven't already, please subscribe. I'm trying to get to 100 subscribers so I can get my own URL, make it easier to find this channel, and just get the word out to more people who are living with this illness, that, you know, it's not the end, and there is always hope, and, you know, there's always, you know, a light at the end of the tunnel. You just gotta sometimes dig and get the dirt under your nails and dig to find it, but it's out there. Okay, so until next time, I hope all is well. Stay strong, stay positive, and be encouraged.